everybody. On behalf of Fernandez Foundation, we welcome you all to the webinar on Respectful Care for All Women, a Utopian Dream in India. While India has significantly improved its indicators, both maternal and infant, but what exists today still, and it's rampant across both private and public hospitals, is disrespect and abuse for women, especially during labor and childbirth. Though this may manifest itself very differently across the two sectors. Most of us in the healthcare community, and this includes obstetricians like myself, nurses, midwives, and or any other healthcare worker who's involved in the care of women in the birthing room, we seem to have forgotten that every pregnant woman has fundamental human rights in childbirth. And what is even more distressing is that women are unaware of these rights, and they are unaware that they are denied these rights. Now, some of us concerned citizens wish to change this. And so to explore this further, we have invited Dr. Janhavi Nilekani to moderate this discussion. Respectful maternity care, is it a utopian dream for India? Dr. Janhavi, whom I have had the opportunity and pleasure and privilege to know, is the founder and chairperson of Aastrika Foundation and Aastrika Midwifery Center. She is a development economist by training and has a PhD in public policy. Her personal experience with childbirth in India left her feeling very disempowered and disappointed in the current birthing process. And this has led her to start Aastrika. Janhavi, over to you.
Thank you so much for having all of us here today. Good afternoon, everybody. Welcome. Just to introduce everybody else on this panel, Dr. Aparajita Gogoi is the Executive Director of C3, Center for Catalyzing Change, an Indian NGO which works to enable women and girls to be fully empowered, equipped to realize their rights, access opportunities, and achieve gender equality. She is also the National Coordinator of the White Ribbon Alliance for Safe Motherhood India, and is an advocate for health and rights, working with a single mission to make the lives of girls and women in India better. She has almost 3 decades of extensive experience in defining approaches and strategies and building campaigns on community mobilization and amplification of women's voices. She holds a PhD in international politics from Jawaharlal Nehru University, New Delhi, and has achieved recognition for her work in various forums, including The Guardian UK marked her as one of 100 world's most inspiring women. Thank you so much for having me, Dr. Evita. Dr. Evita Fernandez is a renowned obstetrician and the chairperson of Fernandez Foundation, Hyderabad. She is a fellow of the Royal College of Obstetricians and Gynecologists in London. She strongly believes in the need to empower women to make choices, especially with regard to issues surrounding birth. Dr. Evita is a champion of natural birthing and midwifery in India. She has spearheaded the country's first professional midwifery education and training program. Her professional midwifery services campaign is committed to creating a national cadre of professional midwives who are vital to the care of low-risk pregnant women. In a career spanning 3 decades, Dr. Evita has been at the forefront of maternal and child care in India. Finally, I'd like to introduce Amitha Sravanthika. Ms. Amitha is a nurse practitioner and midwifery educator with the State Midwifery Training Institute, Telangana. She has over 15 years of experience in nursing and nurse training. She is among the first batch of midwifery educators in the state of Telangana and has been at the forefront of implementing respectful care to women in public health facilities. It's really exciting to be here today with all of y'all. Today, as some of you may know, is the International Day for the Elimination of Violence Against Women 2022. And it's an opportune day for this topic of how do we really stamp out disrespect and abuse in public and private healthcare facilities across India and ensure that respectful maternity care is not just a utopian dream, but something achievable, at least for a huge fraction of the population of our country. So, Dr. Evita, could you tell us a little bit more about the context of today's topic and about what is the prevalence of disrespect and abuse in India and why it's such an important topic that we hear today?
Thank you, Janhavi. To begin with, I'm sure all of us agree that childbirth is the most significant event in a woman's life. And during the process of labor and childbirth, she's most vulnerable. And this is such a sacred space. But women are subjected to, indignities. There's no privacy, staff don't listen to them. And if a woman experiences the most significant event of her life, then she's scarred for the rest of her life. It's important that we address this today. And studies have shown that at least 70% or more of our women across our country are subjected to such indignities. And along with this, apart from a staff that are insensitive, you have beds that are not clean, there's no running water, toilets are dirty, information is not there, no permission is sought. So it's time that we address this, and no better day than today.
Thank you. Dr. Aparajita, you've been a trailblazer in advocating for respectful maternity care in your role as the national coordinator of the White Ribbon Alliance in India, and as well as all your other work. But could you tell us a bit more about what exactly people mean by respectful maternity care and about the 12 rights, the universal rights of women and newborn?
Thank you, Janhavi, and thank you everyone for inviting me to be part of this meeting, this webinar. Apologies, I'm not too well today, so forgive me if I start sneezing or coughing in between. But thank you again for the question. Respectful maternity care, I think the first thing that we need to understand when we're talking about it, that it's actually a universal human right that is due to every childbearing woman in every health system. And I think what is really important to note is that respectful maternity care must be taken as an integral part of quality of care. When we talk of quality of care, we cannot just talk of clinical aspects, but we have to talk about how a woman is treated when she, is lying on the delivery bed for childbirth, or when she comes for ANC or PNC. The first thing that I would like to share is, often we think that disrespect and abuse only happens in poorer countries, happens to poorer women, but that's really not true. Global evidence tells us that this is a global phenomena, and it happens to well-off women, it happens to women who deliver in private facilities, it happens to women who are poor and who delivers in public facilities. So I think that's the first thing to remember, that it is not a problem of the poor, it is not a problem of the uneducated, it's a problem that all of us need to look at. The second thing is, which is really kind of a very important matter in my opinion, is that why is disrespect and abuse so much pervasive and normalized? Every day around the world, if you stand in a labor room, if you stand in a maternity ward, you will see different aspects of disrespect, which ranges from physical abuse to downright kind of disrespecting a woman's autonomy and dignity and choice. So when you talk of what is respectful maternity care, it really, I want to explain this in a negative kind of a context. So what is not respectful maternity care? Globally, people have agreed that there are 7 domains of disrespect, and I'll quickly kind of run them through: physical abuse, non-dignified care, non-consented care, non-confidential care, discrimination, abandonment or withholding of care, and detention of facilities. So respectful care means that women are not subjected to any of these domains of disrespect. In our research in the country, in our understanding of the evidence from other states, respectful maternity care really means that a woman is not discriminated on the basis of her religion or a race or her ethnicity or her age, language, educational status, because of some traditional beliefs that she may hold, and also her educational level. And I want to run you through a couple of examples, testimonials from women, so that it'll understand what the issue, it'll help you understand what the issue that we're talking about. And I'll just read 2 testimonials and I'll hand it back to Janhavi. There's a woman who told us that all throughout labor, doctors and nurses would come and insert fingers inside my vagina. They never explained to me anything of why they were doing it, nor did they take my permission for any examination or procedure. Now, we may think that it is doctors and nurses know best and they are doing what is required to be done. But from a woman's perspective, no one is taking her consent before, some of these clinical kind of an action. The second thing that I want to talk about is a woman who talks about I went to the hospital for my delivery and I had a bitter experience when my labor pain started. Instead of taking care of me, the nurse at the center started screaming at me. One of them asked me that if you want care, if you want respect, you better go to a private hospital or deliver the baby at home. So I think these are some of the incidences, Janhavi, which talks about what is respectful maternity care, what is disrespect and abuse, and the prevalence of it. But I want to end by saying what Dr. Evita had mentioned. Women's experiences during childbirth can either empower them, comfort them, or inflict lasting damage and emotional trauma. And this is what we are here today to look at. Back to you, Janhavi.
Thank you. You both raised such valid points. I think one of the things which came out in both of what you said is that this is not only in the public facilities. The nature may be different in private facilities. What Dr. Aparajita, what you mentioned about a lack of autonomy, that is really rampant in the private sector space, even among the most elite in our country. Often there will be a legal process of consent taken for, at least for a surgery or so forth, but I often call it fear-based consent rather than informed consent, that it is the consent, the legal written consent is often taken by misrepresenting facts or not giving a very accurate sense of the risks and benefits for a lady to take a true informed decision. Having said all of that, it is likely, I would still argue that problems of disrespect and abuse are often worse in the public sector. Certainly you don't hear just because the private place is a marketplace where at the end of the day, women can opt for another hospital if a particular hospital is very disrespectful and abusive. That somewhat curtails the extent of disrespect and abuse we see. Whereas in the public facilities, often, there is a single public facility in a certain geographic region and there's very little choice women have, and hence the issues are even worse there. So that brings us to what I wanted to discuss with Ms. Amitha. Because you are working every day, Ms. Amitha, in the public sector hospitals in Telangana as a professional midwife and a midwifery educator. So many of us who work in this space, to increase access to high quality, respectful maternity care, believe that establishing a cadre of professional midwives in India is a very key solution, because midwifery has a culture of ensuring respectful maternity care. Dr. Evita and Indicor and others at Fernandez Foundation have really been pioneers at training midwives and midwifery educators. We at Aastrika Foundation also invest a lot in midwifery programs. Could you tell us a bit more, as one of the first midwifery educators in Telangana, on how does midwifery differ from routine medical care? And why does midwifery improve respectful maternity care for the mother? What is so unique about midwifery that improves access to RMC?
Yes, thank you, Dr. Janhavi, and thank you for inviting me for this webinar. Really, as you rightly said, that I was a part of the first batch of Telangana, trained as a midwifery educator. Really, midwives are the independent practitioners. That is, we are caring for the mother. Specialized care is given for the low-risk mothers, and we are professionally trained midwives, and we are specialized, and we are practicing independently in the public facilities. Whereas the other nurses who are, on the other hand, they offer care in the maternity units, and they are trained to take orders from the specialist. And in the midwifery educator training, I learned that the respectful maternity care is a heart of the midwifery, where I have a reflection of my own birth, traumatic birth experience. Then I became determined that I should never see any woman who has to face this, the same thing which I have faced. So I started practicing the midwifery as greeting the mother with a respect and making the birth environment so feasible for them, comfortable, and assessing their emotional well-being, how they will be doing, and in this process establishing a bond. And when I assumed a character as an educator, I started to make our trainees to be clinically competent Okay, and then they acquire a change in the behavior. So by this practices, when we have started our midwifery practices, we started seeing the positive responses from the mothers. So that now we are very glad that all the mothers are asking the midwives. And I'm happy to share that in the Telangana, in public facilities, 10,865 mothers has experienced the positive birth experience. That's a great thing what we have seen in the public facilities.
That's actually tremendous change in just a few years. A lot of mothers have been directly touched by your efforts and your colleagues' efforts, which is really something quite remarkable. Dr. Evita, could you've talked a lot about, you started talking about the kind of traumatic birth experiences women go through. I think we don't talk about these issues enough, and maybe many of our audience wouldn't have a very clear sense of that. Could you give us a little more detail on what is the kind of experience that sometimes stays with a mother for, a prolonged, often years, and how can we support them through it? And just over to you.
Yeah, Janhavi, one of the first things I learned when I began my journey with midwifery way back in 2011, which I didn't realize as an obstetrician, was women's memories of their childbirth remain with them a lifetime. And that made such a deep impression on me, because to me, that is such a basic truth. We who are serving women in that space need to carve it in our minds, in our hearts. And straight away, our response to the woman would change. The second thing I realized was if a woman has a positive birth experience with caring staff, competent, kind, respectful, and she gets that support, she's listened to, she's involved in decision-making, she steps into motherhood with such confidence. The bond between her and her baby is established for life. But if she's traumatized by insensitive staff, and Dr. Aparajita spoke to us about women having vaginal examinations without any consent or explanation, she's scarred for life. She's traumatized. She may not even want to have another baby. Or if she gets pregnant because she's given no choice, she has to come back into an atmosphere where she's scared, and probably goes to a private hospital with the hope that she'll get better care, and ends up maybe in an unnecessary cesarean, selling everything she has to pay that bill. So the cascading effect of a traumatized childbirth experience is for life. And that is a public health issue, because then you're nurturing a society of women who step into motherhood with depression, with postpartum blues, no confidence. That affects the family and society. So I think we need to get birth right. If we don't get birth right, we've lost plot completely.
Thank you so much for that. There's a small anecdote to build on that. When we started Aastrika Midwifery Center last year, I happened to run into one of my mother's friends in a waiting room of just randomly after a very long time. And I said, "Oh, hi, Auntie." And she said, "What are you doing these days, beta?" And all I said was that, "Oh, I started Aastrika Foundation 2 years ago, and I've recently set up this hospital where we're actively trying to ensure respectful maternity care, because there's a lot of disrespect and abuse in labor rooms, and it's very common." And that was all I said. And I actually felt very bad about it, because that was enough to trigger her. She actually started crying about her birth experience from 30 years ago. That's how powerful these traumatic experiences are. They truly last decades and decades. Is there any, Doctor, just to continue that, let's say somebody has already had a traumatic birth experience, which sadly is the case for so many women in our country. What can we, while we continue to work on improving birth experiences, what do you think we can do for those mothers who already have carrying this sort of heaviness around? Is there something we can do to help them in the short term?
I'm absolutely convinced, Janhavi. I think we need to provide a safe space for women to come back and talk, probably to other women, about their birth stories. Because in talking in a safe environment with somebody who's listening to you with all the sensitivity that can be given, there is a certain level of healing that happens. But a notch higher, go if there are, if a safe space can be provided even by healthcare workers. And I'm more than willing to be there to listen to women, to see how we can improve this for others, because these stories help us to make sure that it doesn't happen to somebody else. And I think if there's anything we need to commit ourselves to today, is to create that space for women. Whether you're poor, rich, I don't care, but you need to talk about it and find healing in that talking. Today, women don't know where to go. Who do they talk to? And they carry it in their hearts for life.
Thank you. Yes. If people know support groups, like I got one or two in the comments, please do share. We can even read them out at the end, because it would be lovely to connect more women to such services. So, Dr. Aparajita, one of the things we at Aastrika feel is that, on the one hand, yes, we as a society have to stop accepting disrespectful care. At the same time, many of us, those of us in the space, have to start showcasing what positive birth experience look like, so that women start to question and challenge. As of now, I mean, I think you and I agree on this, that poor quality care and disrespectful care is just normalized by everybody, be it the family or the provider. What are the factors behind that? Why has it become such a normal thing which nobody even questions that, even though there's so much rampant disrespect in every segment of society?
I think, Janhavi, what you pointed out is the root of the issue that we're dealing with. On one hand, we have widespread prevalence, and at the same time, we have widespread acceptance, right? So I'm going to talk about prevalence first. I mean, all our research have told us that it is happening because we are not really introducing we don't really monitor respectful maternity care in a hospital, private or public. We often brush aside respectful maternity care because we say, oh, there's too much of high patient load. We have, one health provider looking at 30 women. There is shortage. So I think there are some of these given that because we are operating in a difficult circumstance, we do not have the time to be quote unquote nice to women. Right. So that is one reason why people still feel that respectful maternity care is not really necessary. We can't do it. But in every conversation that we had with private providers or public providers, health providers, it's not like they are janbujke knowingly they're going out of their way to be bad to women. They talk about, there is a work culture which normalizes such behavior. I often talk about this, and you go to a premier hospital in Delhi, everybody in the maternity ward in the labor room is called Rani. Nobody bothers to learn their names. And this is something that they've seen the seniors doing, right? And they feel that this is what it is. So I think we haven't been able to reach out to health providers to talk to them about patient rights, right? To talk to them about being socially inclusive, being gender sensitive. We told them about communication and interpersonal skills besides teaching them clinical skills? Are we talking to them about empathy, about humanism? So I think there is not enough reach out to the service providers to talk about what really constitutes respectful maternity care. So that's infrastructure, policies, and behavior. That's the cause for prevalence. Now acceptance, and this is where we go into really, really kind of murky and sad ground, because women in our country, you cannot really separate how they are treated at childbirth with how she's treated her entire life. We do not value girl child. We do not value women. We don't think their autonomy is important. We don't involve them in a decision making. So if the girl can't decide whom to marry or how many children to have, the same kind of extends to when she's giving birth to a child. So I think it's embedded within the larger kind of lack of women's empowerment, lack of women's autonomy. And women have often told us that coming to a facility for childbirth, you're getting good quality care. And if you're abused and disrespected, that's a trade-off. But if we want the doctors and nurses to care for us, even if they kind of, do a little bit of disrespect here and there, it is fine. Right. So that's one kind of acceptance from the woman and the family side. And unfortunately, If you're poorer, if you're less educated, your acceptance level is higher. So that's the reason I think I don't want to just talk of problems, Janhavi. I want to also talk of two solutions. I think it's really important that we work with the health providers in helping them kind of understand what a woman needs and what is respectful maternity care. And we also have to work with women to help them kind of really demand and ask for their rights, including maternity rights. Over to you.
Just to build on that, what are some of the major solutions you feel are important for us to work on?
Yeah. Of course, midwifery. Amitha already talked about that. So I think we have to shift also to women-centered care, right? So I think midwifery is one big solution that I am rooting for. And I'm so glad that the country has created a cadre in 2018 called Nurse Practitioners in Midwifery. Our country is setting up the midwifery-led care units. And I think if you look at one solution, this is, of course, not the silver bullet, but this will go a long way. The second solution, Janhavi, really is to work with women. Women need, you talked about giving consent out of fear, but women need to understand what their rights are. Women need to demand that their decisions are also taken into account. Women need to demand that they have the autonomy to seek care or what kind of care to seek. So I think two levels: work with health providers, infrastructure, all of that, but also work with women so that they stand up. Information is power. If they have the information, these are my 5 rights, 7 rights, they will ask for it sooner or later.
On that note, I have to say, I do love the little videos that C3 puts out on a whole range of topics for awareness. I think that kind of small video bites are actually extremely powerful. And one of many things that all of us are working with. I love that effort from C3. Ms. Amitha, how has it been? Have there been challenges in implementing this midwifery and respectful maternity care in the public sector? As Dr. Aparajita was saying, that midwifery, I think we all in this room agree that is one of the key solutions to enabling respectful maternity care. But then saying we should start having midwives and midwife-led care units is one thing, and for you and your colleagues to do it on the ground, I'm sure is a whole different ball game. So, what have been some of the challenges, and how far do you think midwifery units, at least in Telangana, can go?
Yes, Dr. Janhavi. As soon as we started the midwifery, in our practice in the public sector, they all had many questions that how you will be assessing the progress of labor in all fours position. How can the mother give birth in the standing position? So for all this, what we have to do is we have to begin to support the mothers in alternate birthing positions, and the doctors and the nurses should be beside us. So we all know that seeing is believing. Then this helped that when they have saw us, they started to trust us and they gained confidence in us. So with this, we could implement some of the evidence-based practices. Mostly during all the evidence-based practices, we had many calls with the doctors. But when we are practicing, when making this happen in our facilities, in public facilities, right now, the obstetric champions are there in all the facilities where the midwives are posted. And with the collaborative care, as we are emphasizing on the collaborative care, so now we are practicing, and they are endorsing the midwifery practices in public facilities right now.
And do you think that there is a lot of appetite in Telangana? I mean, Telangana, unfortunately, is the state in India with the highest cesarean rates, and aside from RMC, a high normalization of operation in this very early introduction to midwifery. Are you seeing enthusiasm from women and families themselves? Do you think it can go further in Telangana and that there is a lot of appetite for it?
Yes. Right now we are having an administration like that. That health minister is very keen on the normalization of the birth, and we have very scope for the midwifery in the public sector right now. And according to the National Family Health Survey, we have seen that institutional births are increasing from 92% to 97%. And also the birth has been increased in the institution, that is 21.3% has been increased. These are all the changes what we are seeing, and the structural and individual changes are also coming in the public facilities.
It's always good to get a positive read from the story and watch it happening. Yes. There are several audience questions. Let's just pick up some of them. I think you can, Dr. Aparajita, I know you're typing, but I think you could actually just to answer that question verbally. There's a question for you that Dr. Aparajita, like the Lakshya guidelines have been formulated to improve the quality of care in labor rooms, do you foresee RMC being implemented too at a policy level at state and nationwide?
Well, I'm really happy to share that the Government of India, the Health Ministry, has taken on RMC as kind of a central pivot when it's talking of policies and programs that are on maternal health. So yes, Lakshya has 3 objectives, and one of the objectives, Lakshya is a program which is meant to improve labor room conditions. So Lakshya's one of the 3 objectives is promoting respectful maternity care. And I can reel off multiple programs. Like I said, the nurse practitioners in midwifery is supposed to help really promote respectful maternity care. And I'm so happy to see Amitha here, and we are looking forward to more training institutes and our midwives, being out there in the midwifery-led care units. If you look at Suman, which is kind of the umbrella maternal health assurance program, you see respectful maternity care there. You look at guidelines like Skill Lab guidelines, you will see RMC there. So it's a big achievement that our government is really incorporating respectful maternity care. Now it is on people like us to ensure that it is implemented. India is huge, it's wide, in some states it's easier, in some states it's difficult. So I think it's really, really now on us and the government and the provider to ensure that respectful maternity care is actually being provided. And I have to tell you that we have been working, for example, with the Aurangabad Medical College, and they have about 19,000 childbirths every year. You can't have a busier facility. And we did a baseline and we worked with them, and they have kind of provided quote unquote RMC compliant care. So there are many examples where people are doing it. Of course, we want to bring attention to the issue, but it's not like, nobody's kind of got RMC yet. So like I said, really happy that it is there. Now it is on all of us to make it happen.
I completely agree with that. That for me, it's been a real bright spot in the last few years that every single policy that has come out of the government has centralized RMC, including the Lakshya guidelines, which talk about it. Yeah. And that consistency from the national and as well as state governments has been a pleasure to see. And as you said, many case studies, Aurangabad, Fernandez themselves, Sitaram Bharatiya Hospital in Bombay, Aastrika, to an extent, a lot of pockets where really there has been change, including in public facilities. And it is on all of us to build on that. Dr. Evita, a question which I would ask you to take that, I think it was maybe somebody spoke of obstetric champions, and really you have been the foremost obstetric champion in India of midwifery. And as an obstetrician to challenge the system is extremely rare, as you know. So one of the questions that has come in from the audience is from a healthcare provider who says, as a healthcare provider, I constantly reflect on how we can move away from a paternalistic healthcare delivery model to a more inclusive model. How do we encourage fellow clinicians to embrace this, since culturally we still hold deep beliefs that doctor knows best? Over to you, Dr. Evita.
Good question. Tough to answer, but what I have discovered and learned over the years is the change has to begin first with me. And if I'm in a position of leadership, I need to lead by example. So every time we get a fellow clinician to have that light bulb moment and realize that, yes, we've been doing things differently because we were trained that way, but that needs to stop. And I think by being consistent in our own practice, by changing your own childbirth practices right from the time the woman entered. And as Aparajita said, woman-centered care. Gosh, for 22 years, Janhavi, I thought I was the most important person in a woman's life during her pregnancy and childbirth, because I was at the crest of my career. And then when I started my journey with midwifery, I realized I had got it all wrong. I need to change. And I thought we were offering woman-centered care. And I had to do a 180-degree turn. So unless you're convinced, that change doesn't happen. But it's relentless pursuing, and we at Fernandez are certainly privileged because we get about 20 residents every year coming into our institute. Now, these are going to be future obstetricians. Now, all of them have to work in the midwifery-led unit for 1 week, just following a midwife and just understanding what woman-centered care is. So that's our little bit in trying to change the world in India. And I'm very, very hopeful because I endorse all that has been said. The government is really championing the cause. And with our midwives in public hospitals, I think in the next 10 years, we're going to get it right.
Ms. Amitha, a question which came in for you is, what are the challenges? Have there been challenges when you work in tertiary facilities versus district hospitals? Because tertiary hospitals being busier, being more overwhelmed, does it seem easier to implement RMC in the, well, district hospitals are also very busy, but relatively?
Yes, Dr. John.
Depending on the scale of facility.
Yeah. Right now, I'm presently working in the tertiary hospital, Nilekani Hospital. Yes, we used to face many challenges, but as I told that, when we are making them to understand our midwifery concepts, when they are seeing us, they started to understand what is a midwifery philosophy. And now we could help out in the providing the mothers, as mothers are also seeing and seeking our services as a midwife. It has been a very smooth way for us to render our midwifery services, and we could provide the privacy and maintain confidentiality and being with the mother and providing continuity of care. All these things we could do right now in the tertiary hospitals. But still some challenges we are facing. But, as we are taking tiny steps in midwifery, we could face the challenges and we could implement those.
Dr. Evita?
I'm facing a great risk when I say this, but I'm going to simply say it. I think the biggest challenge in this country is we, the obstetricians. I know I'm putting a gun at my head. I know my colleagues are not going to like it, but I do feel the obstetric fraternity today forms the biggest challenge. And we are, well, let's just take FRCOG. We are 35,000 strong and more. And if each one of us could understand woman-centered care as we ought to understand it, and have the courage to change our practices when change is required. I'm not saying that we're out there to destroy everything, that every obstetrician is mean and horrid. No. Some of us are not aware that we need to change. And there's so much evidence. If only we could stop and listen to the women who are talking to us, whom we are privileged to serve, I think that would give a huge impetus, huge push to the movement across the country.
Thank you for that, Dr. Evita. I mean, I think definitely obstetricians, as you've said, have to be part of the solution. Do you have any words to add on how we can make that happen, or even how you started to get into questioning the obstetric? I remember you wrote a piece once, I think it was for FRCOG, on how for the longest time you didn't continue with the normal model. And do you have any words on what could be the first, let's say we have obstetrician champions or to-be champions who are at least open to, exploring these new ways of women-centered care. What would be the first thing they could do in your eyes? What is it? Exposure visits? Is it reading? Is it talking to their own clients?
I think it would begin if we could get a group of obstetricians together and get a few women who would share their birth stories with us. And if we could be humble enough to listen, I think that would be a good step to start with. Because all we need to do is to hear those stories. And that is enough to start the reflection. And after that, we start working on the evidence. To me, that sounds simplistic, but I think it's very powerful. When we started the midwifery program in Telangana, Janhavi, it was so difficult to control my tears because the first cohort of future midwives of Telangana were a mixed group of nurses with varying degrees of experience and a lot of mothers in that room. And we began to talk about respectful care and we began to share birth stories. it was emotionally very powerful, and it took me many days to recover from that. And I could identify myself with some of those, stories. Oh my God, I did that. Yes, when I was young and stupid. Yes, I did treat women like that. I didn't even realize the harm that I caused, the trauma that I caused. So I think listening to these stories would help us.
Thank you so much for that. I just want to, though these are in the chat, I would just still want to mention briefly that Dr. Aparajita shared, a link in the chat box for a site which hosts many respectful maternity care resources, both small animated videos and all of the 12 right graphic messages, as well as the RMC charter in multiple languages. And I do encourage you to go look at that for those who would like to, pick up more on this topic thereafter.
Somebody has also posted a site saying we provide a safe space. That may be worth announcing.
I'm also trying. There's
Somewhere
a chat box and a Q&A.
Yeah.
Okay. This is a message from Gulpriya that we are creating a safe space for thousands of women as part of Khud Se Pooche, a movement by women of Bihar to acknowledge and articulate dignity in healthcare. Right. Dignity is so intangible. Women created safety pin as a symbol, now a permanent installation in Patna. A pin that brings dignity to healthcare and also talks about safe spaces. It's a big community which allows people to be vulnerable and open. And there's a link in the chat box about it, and that does sound like a fantastic resource, so please do look it up. In general, I think that 2 or 3 good resources are linked in the webinar chat box, which I believe all of you can access. Just looking at the remaining questions. A somewhat straightforward one, Ms. Amitha, that in this process of setting up MLCU, has it become possible for men to support women during labor in public sector hospitals?
No, Dr. Janhavi, we are striving for men to be a birth companions. And when there are, in some districts, we are allowing, means we could able to support the mothers with a birth companion. And mostly we are trying to choose the mother to choose whoever she is comfortable, whether it's a mother, sister, or a friend, or whoever she is comfortable, we are trying to make them to be a birth companion for them.
Thank you. It is, of course, understandable that in a situation where there are multiple mothers in a space, it can be hard to bring in men, but if we can at least ensure that everybody has one woman companion with them, that would go a really long way. We only have yes, Dr. Aparajita.
Since we're talking of involving men, I think we must look at involving men beyond the stage when she's in the labor room. I think another thing that we need to talk about, how do we get men into the conversation early on, starting from contraceptive choices and spacing and all of that. I know that we have difficulty in getting men into a labor room, but what about before and after? And I think to do that work, we have to also work at the family level and not just at the system level. So men is like really missing from the conversation. And I think that is something that we need to look at very deeply. Thank you.
A question which had come in for me was specifically with my name was, how can we raise awareness about RMC among women? And while there are a lot of resources and so on, and I do encourage people to look up all of that, I think a very simple answer is just if we as women would talk more about our birth experiences, at least with our own friends and family. That itself doesn't happen. It's quite a hush-hush topic, even among the relatively liberal segments of society, let alone everybody else. Just being open about our own birthing experiences, both good or bad, and including very much the good. I, after all that questing, a difficult time finding good healthcare, but finally had an excellent birth experience. And just talking about that, I think, encouraged a lot of my friends to reach higher than they would have otherwise. Putting out our stories, being more open itself would be a very simple thing that each of us can do. We're sort of running out of time. So, and just like any closing remarks from all of you, Dr. Aparajita?
Thank you. Just to say that, can you all hear me? Okay. I think, first of all, thank you everyone for talking about this issue. And I just want to have like 2 closing comments. A lot is happening. I spoke about RMC policies and our need to implement. We are, for example, working with Aastrika and creating a learning management system where health providers can log in and learn about, RMC and, what is provision of RMC. But in closing, I really want to kind of go a step further and talk about, in the beginning, Janhavi, you asked me to define respectful maternity care, and I want to end by saying that respectful maternity care is more than the elimination of disrespect and abuse. Absence of disrespect and abuse does not equal respectful maternity care. We have to go kind of a step further, and RMC would be there when we are assuring women have the dignity, privacy, confidentiality. They can make informed choices and they get continuous support. So I think time is right in the country to kind of expand the definition of RMC beyond elimination of disrespect and abuse. And the second closing comment I really want to talk about is often when we talk of why is RMC not there, we hear that there is no infrastructure, there is no personnel, there is no fund, we are operating low resource settings. But I want to make the point that respectful maternity care is also largely dependent on the professionalism, on the goodwill, and the commitment of the people within the system. If you want to provide RMC, you can do it. You can train your providers. You can make your labor room work a little differently. It doesn't really cost money to be respectful to women. Thank you.
Thank you so much, Ms. Amitha. Any closing remarks?
A significant change that is to unlearn the things what we are practicing right now, and to learn the things that evidence-based practices teaches us, and to improve the care of the woman. And also nurses should strongly consider the career in the midwifery. And also if there is a clear pathways that helps in the growth for the midwife, that will be very helpful. And every woman should get the respectful maternity care. And we have to take that oath and pledge. Then only we can accomplish that.
Thank you. I thought I'd go first and then give it back to Dr. Evita to close the panel. Thank you so much for inviting me, Dr. Evita, to be part of this. And just one thing I think I would like to say is that it is really important for mothers and India's women to demand good quality care and respectful maternity care. And particularly the elite and the wealthier women of India have to outright demand better care when even we and our friends and family accept such poor quality of care from hospitals. There is no pressure on the healthcare system to change. Nobody is intensely altruistic. The moment there is enough pressure from women for better hospitals to go, that people opt for the ones who are doing better, that Aurangabad or anywhere else which is actually giving good quality care gets more mothers. That is what will really drive the whole system towards improving. And it's something I ask from everyone, is to really go out and insist on better for yourself and your friends and your family. Over to you, Dr. Evita. Thanks again for having me.
Okay, thank you. First, let me thank you, each one of you. It's been such a privilege to have you on this panel, and that we're here together to discuss a common passion, common focus. And what you just said, Janhavi, is the first step towards breaking down that whole paternalistic attitude, to let go of the power and give it to the woman. I mean, that's really the first step that we all need to do. So my request or my takeaway from this is for us as obstetricians to start listening to the voices of the women that we serve. And that, I hope, every woman will feel safe in the hands of the healthcare worker she trusts, and that she gets the respect and the dignity and the kindness and the competent care that she deserves. Yes. Thank you very much. It's been such a privilege to have all three of you on this panel. Thank you.
Thank you so much.
Thank you so much.